Hello everyone, myself Dr. Taposh Kumar Pal and welcome to our channel Physiomax Organization. Under the part of Physioversity, we are continuing our medical educational series and today we will be reading about the knee joint ligaments. As we know, knee joint is one of the most important weight bearing joint and that's the reason the ligaments of the knee joints needed to be very strong because of the stability, and these ligaments which gives the stability of this ligament of the knee joint. So today we will be reading about the knee joint ligament. Before that, those who are new for this channel and don't forget to subscribe the channel, and those who are watching our videos, before you go to the other parts of the anatomical education, don't forget to like this video. Now we will be starting one by one. And we will be seeing one by one about the knee joint ligaments. So first we will be seeing the knee joint ligaments which are present over here. So the first, which is this, there are two important ligaments which is present in this. One is the anterior cruciate ligament and the second one is the posterior cruciate ligament. So once more to repeat, the first two ligaments which is present in between is the anterior cruciate ligament and posterior cruciate ligament. I will be knowing in a detail about the origin and the insertion of the ligaments and the action of the ligaments. And another two ligaments which is present on the both the sides of the knee joint, there's the collateral ligaments. As we can see, this is the medial side, that's why this is the medial collateral ligament, and this is the lateral side, this is the lateral collateral ligament. So like this we need to remember there are most four important ligaments which are present over here. Two in between, that's the anterior cruciate ligament and the posterior cruciate ligament, and two on both the sides, this is the medial collateral ligament and this is the lateral collateral ligament. So we will start one by one. First we will be seeing about the anterior and the posterior cruciate ligament, how it passes from the knee joint. So first, when we will be reading about the knee joint ligaments, we need to remember knee joint ligament, anterior cruciate and the posterior cruciate both runs from down to up. Again, to repeat, both the ligaments it goes down to up, that means both the ligaments starts from the tibia and it runs towards the femur. So for the anterior cruciate ligament, the important ligament which comes by the name anterior, it starts from the anterior aspect of the tibial plateau. As by the name, both the ligament it's crisscrossed to each other, that's why it's got named as a cruciate. So this ligament it starts from the anterior aspect of the tibial plateau, and like this it directly goes to the posterior aspect of the femoral condyle. So like this, the anterior cruciate ligament, once more to repeat, it starts from the anterior aspect of the tibial plateau and it goes towards the posterior aspect of the femoral condyle. If I talk about the second ligament which is present and whose name is posterior cruciate ligament, and it starts from the posterior aspect of the tibial plateau and it runs towards the anterior aspect of the femoral condyle. So these the ligaments it's in a crossed way, crisscrossed to each other, and that is the reason they are named as a cruciate ligament. So we came to know about the two important ligament and how it passes from the tibia to femur. Anterior cruciate it starts from the anterior aspect of the tibial plateau, goes posteriorly towards the femoral condyle, and the posterior cruciate ligament it starts from the posterior aspect of the tibial plateau and runs anteriorly toward the anterior aspect of the femoral condyle. Now we need to understand what is the major function of these two ligaments. As we know, anterior cruciate ligament it works the time you are doing a stair climbing, and the posterior cruciate ligament it works the time you are descending stairs. What is the meaning of this? The meaning of this is the anterior cruciate ligament are the ligaments it helps during the hyperextension of the knee joint. It prevents the further extension of the knee joint, which can consider as a hyperextension of the knee. That means if your knee will go suddenly in a hyperextended position, that part it's prevented by the ACL and PCL, which helps for the hyperflexion of the knee joint. And that's the reason during football, if you try to kick any ball and if you miss it, there is a certain hyperextension of the knee that makes the ACL to go for injury. And if there is a, during a basketball player, if the player fall down while flexing the knee, and if it goes for the hyperflexion, that makes the PCL to go for the injury. Now we will be reading another two ligament which is present on the both the sides of the knee joint. There is the lateral collateral ligament and this is the medial collateral ligament. Let's see about the lateral collateral ligament. Lateral collateral ligament, it starts from the femoral condyle towards the tibial plateau. It's just present over here from the femoral condyle to the tibial plateau. That is the lateral collateral ligament. And again with the medial collateral ligament, it's present from the medial aspect of the femoral condyle to the tibial plateau. And these are the two ligaments which gives the valgus and varus stability of the knee joint. That means these two ligaments helps during the lateral and the medial force stability. And whenever there is a sudden thrust either from the lateral aspect or from the medial aspect, these two ligaments might go for the injury. That's when the ligaments will go for the injury, we should tell that condition as a ligament sprain. Once more to repeat, if there is an injury to the ligament, that's the what's called as a ligament sprain. And most of the common times ACL and PCL are more common among the footballers. Among the rugby players, these ligaments are more common to have an injury. Again, for the basketball players, the PCL ligaments is more common to have injury. But if during this injury, if there is a rotational activity, again the ligaments of the lateral side or the medial side might go for the sprain. Now, apart from these four, apart from the anterior cruciate ligament or posterior cruciate ligament, we are having another very important ligament which is present on the posterior aspect of the knee joint, and thus the name is oblique popliteal ligament. This is a very small ligament, although it's present on the posterior aspect and just present over here like a crossed maneuver just below the muscle of the popliteus, and that's what it's named as a oblique popliteal ligament. And this ligament, it helps during the stability of the terminal knee extension. When the knee used to go for the last 5 degree to 0 degrees of the extension, that's the time these ligaments helps to make the stability of the knee joint. So we came to know about the 5 ligaments. Once more we will repeat it. We came to know about the ACL, we came to know about the PCL, we came to know about the LCL, we came to know about the MCL, and the posterior aspect we came across about the oblique popliteal ligaments. These all the ligaments helps to give the stability of the knee joint, and if there is an injury to this ligament, that's what's called as a sprain. And those who are having a ligament sprain, mainly for the sports injury, they are vulnerable to have a weakness of the knee joint, and that makes sudden unlocking of the knee, which is the main function of the limb which gives a stability. That means if you are standing, suddenly your knee might go for a buckle. Post injury, if it is not recovered, that's the reason the knee joint might go for a unlocking, and that how ligament injury loses the stability of the knee joint. That's the main function of the knee joint ligaments. With this, we will end up about the ligaments of the knee joint. I hope you people have understood about the knee joint ligaments. Those who are having any queries, don't forget to ask in the comment box, and those who are again new for this channel, don't forget to subscribe the channel, and those who are watching our videos, do not forget to like these videos, because we need support from you to learn another videos for you. Thank you.